Hello, my name is Dr. Michael Wald, and thank you for joining me today for this very important discussion, which I've entitled High Cholesterol, Now We Know Its Cause. As I mentioned, my name is Dr. Michael Wald, otherwise known as the Blood Detective. I'm an author of several books, including the Anti-Aging Encyclopedia of Laboratory Tests, which teaches people and doctors how to read blood both medically and nutritionally. Besides being a doctor of chiropractic, I did attend medical school. I graduated. I earned my MD diploma, but I did not seek an active license, but I have all that information in here. I'm a board-certified nutritionist and dietitian. I provide acupuncture and life coaching. And I pursued all of those different areas because people need different things. So let's get into this topic. First, I'll begin with a brief disclaimer that this information is not to substitute for sound medical and health advice. It is for your educational purposes. Trap antioxidants, which make cholesterol an anti-inflammatory and antioxidant itself. The structure, the cyclopentanoperhydrophenanthine ring, allows cholesterol to act as an antioxidant. It helps stabilize cell membranes, protecting them from oxidative stress. That means it is important for general health, avoiding disease or delaying the onset of disease, and many other benefits. So let's talk a little bit more about cholesterol and its anti-inflammatory properties. First of all, cholesterol does have anti-inflammatory properties. How many of you know this? How many of your doctors know this? Don't feel badly. They don't know it either. They've forgotten their chemistry. And cholesterol plays an essential role in repairing damaged tissues and supporting immune function. So if you have high cholesterol, there might be a reason for that, and maybe we shouldn't just suppress that with medications. Elevated cholesterol can sometimes be a beneficial response, particularly during times of illness, stress, or even injury, while the body needs more cholesterol for cellular repair. I found that fascinating when I first learned that decades ago. So, what about cholesterol and its relationship to another important biochemical marker in the body known as C-reactive protein? So, what you need to know that is, if your doctor checks your cholesterol and also your C-reactive protein, if both your cholesterol and CRP levels are high, that might indicate chronic inflammation in the body as a cause of the high cholesterol and an increased risk of cardiovascular disease. So increased CRP, increased cholesterol, increased risk. Whereas elevated cholesterol with low CRP levels usually mean that the cholesterol is not harmful. There are other factors to consider, but this is a very important slide and concepts for you to know. A recent article in BBC Science Focus delves into factors contributing to elevated cholesterol levels, and this is what they said. That piece emphasized that while dietary cholesterol was once considered the primary culprit in cardiovascular disease, current research highlights the significant impact of saturated fats and trans fats. In other words, there are other causes of high cholesterol. Cholesterol in the diet does not increase cholesterol much in the average person, maybe 10% at most. It's saturated fat and trans fats, not to mention inflammatory foods, foods that disrupt blood sugar, toxins that promote inflammation. So it's important to think of those and other things. We'll go through many more causes of high cholesterol, whereas your doctor simply sees high cholesterol, does not ask why is it elevated, and gives you a statin medication. And please do go to my website at drmichaelwald.com or any podcast platform and search for Ask the Blood Detective, and you'll find my statin PowerPoint presentation, which has information there that literally is life-saving. You've got to listen to that. And this BBC Science Focus article said that foods high in saturated fats such as red meat, cheese, butter, baked goods, and fried items can raise low-density lipoproteins, or LDL cholesterol, the bad cholesterol, also increases cholesterol and the risk of heart attack and stroke. So that's what the BBC found. So, okay, fine. So what do we need to think about in terms of the diet? So this particular article advises limiting saturated fats in the diet to less than 10% of your total calories. And you can do that with the help of a nutritionally trained practitioner, or even as low as 6% as recommended by the American Heart Association. Instead, incorporating unsaturated fats from sources like avocados, almonds, raw almonds, by the way, and fish, which is not overcooked, as well as following a Mediterranean type diet, which is high in fish and of fruits and vegetables, for example, and olive oil. I can't forget olive oil. And whole grains can improve cholesterol profiles. So rather than creating neurotic behaviors and stress, trying to lower your diet to 10 or even as low as 6% of saturated fat, you may not need to do that. You might simply need to incorporate some of these concepts I just mentioned in the healthy diet category. Now, individuals are different. Not everyone responds the same way in terms of their cholesterol levels. So it's important that a practitioner, and I certainly do this, take the time to personally see what people react to so that you know what you're doing. Now, additionally, consuming foods high in soluble fiber, such as apples, broccoli, beans, and lentils, can help lower cholesterol by aiding in eliminating cholesterol from the body. But you need to know whether or not that's what you want to do. If you have an autoimmune disease, you may not want to have a lower cholesterol. You might want to have a slightly elevated cholesterol. If your cholesterol is elevated, but your C-reactive protein, that other lab marker I mentioned earlier, is low, then that is probably a good deal. And if your homocysteine and your ferritin are also low, then that higher cholesterol may be providing those antioxidants and anti-inflammatory and cell membrane stabilizing health benefits. Very, very important to know that. And this article also underscores the importance of regular cholesterol monitoring. That's what you do in a healthcare system. In a healthcare system, you monitor things ongoingly at some sort of regular pace because you want to find abnormalities sooner than later. A disease care system, you do a lab test, you haven't had one in a year or more, your doctor says, oh my goodness, look what's there. We should have, oh, too bad we didn't know this sooner. That's after your first heart attack. So prevention and preventative strategies make sense. Regular monitoring is the key. So the blood detective method has to do with approaching high cholesterol holistically. One example, as I mentioned, is to do the appropriate laboratory test that can help you interpret whether the high cholesterol is an adverse thing or it might actually be a preventative thing. We want to compare your blood work, not just your cholesterol levels, to average individuals like regular doctors do. Your cholesterol range on a blood test, that 0 to 200 range, is where they are. But if you're a 165 or 199, your doctor considers those the same as normal and moves on. But common sense should tell you that there is the potential that 199 makes you much more susceptible to cardiovascular events and other health problems compared to another cholesterol level that's lower, like 165. We know that the optimal cholesterol level for overall longevity is between 165 and 185. It's a tightly controlled area. And my book and the blood detective method, I've determined these optimal tighter areas, these optimal levels where you should be in your labs, which are different than the regular blood ranges that your doctor chooses. Those ones that most doctors use are pretty good at detecting disease because once abnormalities show up on the blood, they tend to be extreme because the ranges are so high. You're waiting just too long and you're not checking often enough. But if you have these tighter optimal ranges, then you see things a lot sooner. And not just the cholesterol, but other things as well. You're interpreting the labs optimally and also comparing you to the average person. Why doesn't your doctor compare you to optimal ranges? Well, he does in probably one area. Some laboratories will actually write on the printout of the lab results, let's say when it comes to the LDL cholesterol. This is the only example I can think of in regular medicine, where the doctors distinguish between an average acceptable range and an optimal range. If your LDL cholesterol, and I've mentioned this on several other podcasts, is 130 or below, that's considered normal. If your cholesterol, your LDL cholesterol is 100 or lower, that's optimal because there's far less cardiovascular events when you're 100 and below. But most doctors stop at 130. They don't try to get you to 100. Why wouldn't they do that? because they're not health oriented, because we don't work in a healthcare system, we work in a disease care system. We work within a system that is disease oriented and does not work on extending the non-disability stage of life as opposed to just the extent of life. Why live longer with multiple comorbid conditions? We want to customize one's diet and lifestyle, carefully interpreting the labs, seeing whether or not one's elevation of cholesterol is a positive thing or it's a negative thing. You can only do that in context with other lab tests. And finally, if you learned something from this presentation, please let me know, and let me know what other topics you might want to hear. You can email me at info@blooddetective.com, and you can certainly call me at 914-552-1442. And please don't forget to take advantage of the free content that is constantly being posted on my website and on my podcasts. On any podcast platform, just type in Ask the Blood Detective or go to the website at drmichaelwald.com. Thanks again, and I'll see you at the next podcast.